I've only done it for 5 years and I've done the same thing, so I've had a pretty normal career so far, I think. Being a pharmacist is rewarding because every day you make a difference in someone's life and you may not even know it at the time. Like, for instance, I used to work in downtown Baltimore and there was a big car accident right outside of our store. An elderly gentleman was driving his car, had veered off the road and crashed into a light pole, and I came out. We were able to stop the bleeding. He was very confused, probably from the crash. I think now people say that they want to be pharmacists, but when I did it, it was either your family had done it. I liked math and I liked science, but I didn't want to be a scientist, and I was one of those that fell into it. I have very set hours, and they're not long at all. It's a basic 8-hour shift. People aren't feeling well, they're in a hurry, they have kids screaming in the car. That's why I love our drive-thrus, so you don't have to come in. A typical day would be juggling people coming to the counter, phone calls, making doctor's calls, verifying prescriptions. It's never been overwhelming and nothing you can handle, but it takes a lot of practice to focus. You're working with people that are sick, that have serious health conditions, and to me, you have to have empathy.
Hi, my name is Rebecca Grandy and I'm a clinical pharmacist at Mission Hospital. So when a lot of people think about a pharmacist, they think about the person in that white lab coat behind a counter at CVS or Walgreens who are counting the medications. But what I do is actually a little bit different. Most of my job doesn't even involve dealing with medications, touching medications, dispensing medications. I do more of patient interviews. I have a lot more patient interaction, and I'm an advocate for the patient with their physician and other healthcare providers that they may have. Making sure they get the best medications for their disease states, such as diabetes or high blood pressures or their cholesterol. As part of my job, we make sure the patients receive the best medication, and one of the ways we do that is we consider the patients from a holistic perspective, taking their preferences into consideration and also what would be best for them as a whole, and helping them prevent errors. One of the biggest things that we do is just getting an accurate, correct medication list that we can give to them to take to their healthcare providers and to their physician. I knew as a student that I wanted to do something in a hospital outpatient setting like Mission, and Asheville's kind of known for being progressive as far as pharmacy is concerned, so I knew I wanted to be here. So I did several of my rotations here as a student, and luckily they liked me, and I enjoyed working with all the people, the patients, the practitioners, and so I decided to stay here as a resident. One piece of advice that I would have for pharmacy students is, if you know what your interest is early on, try to make contacts with people who are in that field of pharmacy. Ask if you can spend a day with them to shadow and see exactly what it is that they do, because pharmacy is a huge world and there's lots of different things you can do. You can work at your community pharmacy such as CVS or Walgreens, you can work inpatient at the hospital, or you can do more of outpatient pharmacy services, which is what I do. I love my job, I love what I do, and one of the things that I like most about my job is my patients. So like I said, I actually follow patients on a monthly basis, and so I have relationships with them and they trust me, and I'm able to help them really take control of their health. Another part that I really love about my job is the collaboration. So I'm really part of a healthcare team. I work with physicians, I work with medical residents, I work with nutritionists, I work with exercise specialists, and it really takes a team to have the best possible care for your patient.